Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about important care that happens 24 hours after birth. At the end of this video, you will understand better how the first day after birth is like. But before we get into that, let me answer some curious questions you have on what happens the first 24 hours after birth. If you are a first-time mom or multi-time mom, and your due date is near, I know your emotions are heightened. You are anticipating how the whole labor process will go and essentially what will happen after birth when you finally get to see your little one. Can I lay on my stomach after giving birth? You can lay on your stomach after giving birth if you have had a normal delivery without complications and find it comfortable. Prop pillows around your waist and tummy area to support your abdomen. If you have had a C-section, do not sleep on your stomach until the incision site is completely healed. Here is an essential guide for what happens the first 24 hours after birth. The first breath. Once the baby is out from the womb, the baby is expected to take the first breath. This should be about 10 seconds after birth. To ensure that the baby does not inhale meconium, that is baby's poop while in the womb, into the lungs, the midwife or doctor will use a suction tube inside the baby's mouth to pump out any fluid or fecal matter. When babies are in the womb, the mother's placenta is responsible for taking in oxygen and giving out CO2 from the mother's bloodstream, so technically they do not breathe on their own. After birth, and removing any fecal matter or fluid, the baby takes the first breath. As the baby's coming out and gets squeezed as it's coming through the birth canal, all that fluid that's been in the lungs comes out, and as baby takes that very first gasp of oxygen, that triggers huge changes in the circulation of the baby. There's something called the foramen ovale, which is just a big flap that sits between the right and left atrium of the heart. It closes once the baby gets that first little bit of oxygen, that first breath. Have you ever heard of someone with a hole in their heart? It happens when the foramen ovale doesn't seal completely, causing improper flow. Cord clamping. After the baby has breathed on his own, the doctor or nurse may cut the cord, leaving behind a stump that is clamped. The cord may also be cut by the baby's father or whoever has been stated to do the honors in the birth plan. It is usually better to delay cord clamping for a few seconds, even minutes after birth, so that the baby can breathe properly on his own. Delayed cord clamping also ensures that the new infant gets vital nutrients from the placenta. It increases blood circulation, boosts hemoglobin levels, increases the baby's iron store and red blood cells. A minute after birth, or when the cord has stopped pulsating, usually about 5 minutes after birth, the cord clamping can be done. Cord clamping is the separation of the infant from the placenta. The process of delivery involves the passage of the baby from the mother's birth canal to the outside world and the expelling of the placenta. The baby, attached to the mother, will have to be separated by cutting the cord and clamping. The stump left is clamped, and cleaned regularly, till it is dried and falls off. This usually takes about 2 weeks. You may choose to bank your baby's cord for beneficial health reasons. Skin-to-skin contact. If you have had a vagina birth without any complications, the next thing that hospital staffs usually do after birth is to establish skin-to-skin contact with the baby, mother, and father. Skin-to-skin contact is a practice of established contact with the child and parents soon after birth. It is very important, and it is what will happen in the first 24 hours after birth. Sometimes, even before the baby is cleaned, the nurses will place the baby on the mother's chest or stomach area to allow baby to feel the warmth of the mother. The baby can also be wrapped in a blanket before placing on mother's chest. Skin-to-skin contact helps to initiate bonding as early as possible. It also helps to keep the baby calm, as baby will be trying to adjust to different temperatures and changes in the environment which make baby to wail. It improves psychological stability and increases maternal instincts. The first hours after birth is critical. so the skin-to-skin contact should not be missed for anything. Not only will you cherish the one you have carried for 9 months and will want to finally hold baby in your arms, but it would also make the child feel loved, warmth, and security. In a C-section birth, immediate skin-to-skin contact may be delayed because the woman may still be down with the anesthesia after the C-section, but it doesn't take too long. As soon as she is awake, she can see her baby. If the father is present at the labor ward, he will also be given the chance to hold the baby for the first time. Cleaning the baby. At birth, baby's skins are coated with a white waxy material called the vernix caseosa. It doesn't have to be washed off immediately from the baby's body, as the vernix caseosa act as a protective layer on the skin, making it softer and helps to protect the baby's immune system. So instead of bathing the baby at birth, it is better to just rub in the vernix caseosa inside the skin. According to the World Health Organization, the vernix caseosa can stay on the baby's skin for 6 hours before bathing the baby. Some women even wait for 24 hours before giving the baby the first bath. While still holding the baby and after clamping the cord, the midwives can use a small towel to rub the skin and wrap the child up in the mother's arm before wearing a sleepsuit, cap, mittens, and socks. The first bath is usually done the next day. Babies born with meconium on their skin or with a condition called chorioamnionitis would need a thorough bath immediately after birth to reduce the risk of the baby getting an infection. Delivery of the placenta. Delivery of the placenta is the third stage of labor. The placenta may not be delivered immediately after the baby is born. Sometimes it takes longer. The placenta will have to be delivered for childbirth to be completed. If the placenta is not delivered, or not delivered intact, it can cause some complications to the mother, like excessive bleeding. After delivery of the baby, the contraction of the uterus continues, leading to an additional gush of blood. Then the placenta is expelled out. If it is C-section, the doctor will remove the placenta from the uterus before stitching the incision site. The nurse may massage the uterus to help the contraction of the uterus and expelling of the placenta if the placenta is not delivered within 30 to 60 minutes. If the placenta is not removed, it can cause the condition called retained placenta, leading to infection. It will have to be removed by surgery. Nursing the baby. As you establish a skin-to-skin contact, what happens after birth is the first nursing attempt. As early as possible, women are advised to put the baby on the breast to start sucking so the breastfeeding process can start. The first milk the baby sucks is the colostrum, a pale brown or pale orange milky fluid that is rich in antibodies to help build the baby's immune system. Even if the colostrum has not started flowing, it is important to encourage your baby to suckle at the breast. It stimulates the letdown reflex. As the baby suckles on the nipple, the receptor cells in the alveoli are stimulated, sending messages to the brain for milk production to start. Putting the baby on the breast immediately after birth promotes bonding, encourages the baby to learn the latching position and how to suck. The woman also starts adjusting to the breastfeeding position that is suitable for her and her baby. Stitching up/perineal repair. After birth, the nurses will inspect the perineum to see if there is a tear. The tear in the perineum after birth is called perineal lacerations. If the baby's head is too large and the vaginal did not stretch very well during labor, the vagina may tear when the baby was pushed out. It is usually common for first-time moms to experience vagina tears because they have not had a baby before. If the vagina tear is small, it is nothing to worry about and there will be no need for stitches, for it will heal on its own. But if it is a 3rd to 4th degree tear, that is, a tear that is close to the anus, a perineal repair will be needed. During labor, the nurses may make a small cut on the perineum to make room for the passage of the baby, and after delivery, it will have to be stitched. A local anesthetic is given to numb the area and reduce pains when stitching. During perineal repair, administering preventive drugs. Newborn babies are given vitamin K at birth because they are deficient in the vitamin. The deficiency can cause internal bleeding, so a shot of vitamin K is given after birth as a prevention. A newborn will also be given an antibiotic drop, erythromycin ointment, in the eyes as a prevention against infections. Hepatitis B vaccine will also be given. Hepatitis B vaccine is usually given for the prevention of the hepatitis B virus, which babies are usually at risk of. OPGAR testing and vitals check. Right after birth, the OPGAR test will be conducted for the baby, to determine the general condition of the baby and if there is any immediate health concern. The first thing to check is the appearance, that is the skin color. They check to see if it is normal. The next thing is the pulse, to determine how well the baby heart is pumping. They test the spontaneous movements of the baby to show how active the baby is. Respiration, the baby's breathing rate per minute, is tested. The OPGAR test is rated on a scale of 0 to 10 and it is conducted the first 1 minute after birth and 5 minutes later. If a baby with a score below 7, doctors usually focus more attention on such a baby. The baby's vitals will also be checked. The heart rate, weight, length, head circumference, feet. All these will be inspected and recorded. They will also check if the baby is looking okay and have no physical abnormalities. They check for internal injuries and check if the baby's temperature is stable. Rest. After stitching, either for a vagina delivery or C-section, the mother can place the baby on her chest and the hospital staff carry out the required test on the baby while she rests. The baby will be cleaned, dressed, and kept at your bedside or the nursery. Mother might take a shower or be cleaned up. You will be a bit dizzy, so you will be encouraged not to move around for a while. You will be given a light meal and told to take lots of fluids and sleep to recover. Thereafter, you can be moved to the postpartum ward, and after a day or two of close monitoring, you may be discharged. If you find this helpful, please share. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.